So next class is blood transfusion. So blood transfusion at the end of the 30 minutes we can give that one. So define the blood transfusion, identify the purpose of the procedure and the site situation which blood transfusion is needed. Then enumerate the different transfusion reaction and clinical signs, appropriate nursing intervention. Then describe the blood product. Okay, so blood transfusion is the procedure that receive the blood product through the intravenous line. So blood components will be circulation to transferring to the blood based product one person to another person to the circulating. Okay, so then purpose, so replace the blood lost during the surgery or serious injury, then restore the oxygen carrying capacity of the blood and provide the plasma factors to prevent the treat bleeding. So patient body is not capable to making the blood properly because on illness, so then that causes and all we can give. Then major injuries of the after accident or disaster, surgery on organ site and liver or the heart, severe anemia, bleeding such as the hemophilia and thrombocytopenia. Then blood types O, A, B, O, A, B. So that is four types will be there. So each person have one type will be there. So O given anyone, but can only receive O. Okay, AB can receive any type, but can you only be the given to AB. Then also every person blood either RH positive or RH negative will be there. So O blood is called for unicell donor, AB blood calls also unicell recipients. So RH positive blood can get RH positive, RH negative blood also we can start RH negative blood. So that one is main. Okay. Then blood banks collect the test and store the blood. So autoclaves the transfusion. So surgery is scheduled in the month and to advance the patient to able to donate their own blood, otherwise stored blood we can give. So preparation before blood transfusion technique test and all is there. So blood find out what blood type is there, A, B or ABO and all. Okay, some patient have allergic reaction will be there after blood transfusion, so that and all we can check. So administration of the allergic reaction we can check. Administrating the blood means blood admission take the place doctor advice or hospital only. Otherwise can be done for the patient home, it's less common. Okay, then administration of the blood law, the needle used to the insert the intravenous, so IV line they can to inserted, and then they will start for blood transfusion. Then at least 1 to 4 hours they can give, depend on how much blood it's there needed. So that product they given, so safely receive the blood quickly. Okay, then during the transfusion the nurse carefully wash the patient, especially first 15 minutes. So nurse carefully wash the first 15 minutes, then reacts the any colors, any reaction it will happen or not. So after the blood transfusion, vital signs we can check: temperature, blood pressure, and respiration and heart rate. Then follow up test may be necessary to show how the blood reacting to the transfusions. So here causes and clinical sign, nursing intervention will be there. So hemolytically what will be changed means blood and donor blood. So here chills, fever, headache and backache and sinus central will be there. Nurses response immediately actions. Then notify the primary care and provide the immediately, monitor the whites, monitor the fluid intake and output, send the remaining blood bag and bag filter and everything. Okay. Then fibril reaction means sensitive to the client blood to white blood cells and platelet plasma proteins. So here fever, chills, warm central will be there. Discontinue the transfusion immediately. Give the antipyretics overload. Notify the primary care and keep the vein to open with the normal saline infusions. Then allergic reaction, flushing, itching, urticaria, branchial wheezing. So stop and slow the transfusion depending agency protocol. Notify the primary care and administer the antihistamine drugs. So if it is severe means stop the transfusion, keep the vein open and infusion the normal saline and monitor the vitals, administration any CPR needed and medication and O2 and all. Circulatory overload means it's a faster circulation to accommodate. So cough, dyspnea, crackles and all will be tachycardia, hypertension will be there. Place the client upright position, feet depend, stop and slow the transfusion, then administer the diuretics Okay. Then sepsis. So high fever, chillness, vomiting, diarrhea, and hypotension will be stop the transfusion, keep the vein open to normal solutions, and administer the IV fluids, antibiotics, blood specimen from the culture, then lab tubing and laboratories and all. So component blood which are collected from the donor and use the transfusions. So here what are the products will be there means packed red cells. So RBC cells most common type of the blood product transfusion. So increase the oxygen carrying to the capacity of the blood to help the body get to the carbon dioxide and waste product. So 1 unit RBC hemocredit 2 to 3% will be there. Then fresh frozen plasma. Plasma is the liquid component of the blood as a protein called clotting factor. So blood volume provide clotting factor and contain no RBPC. Only 1 unit FB increase the 2 to 3 clotting factors. So it's also cell structure necessary for the blood clotting process. So it's any bleeding disorder, platelet deficiency they can give to replace platelet and all. To 1 unit increase the average 5,000 platelets. Then whole blood, so not commonly used, so replace the blood volume to all the product. So then autologous blood product means use the blood replacement following the plan to surgery. It must be donated to 4 to 5 weeks prior surgery. Then albumin and plasmin protein means the blood volume expander provide the plasma proteins. So containing it's a specific clotting factors. So clotting factors 8th and 14th and clotting factors the fibrogen the deficiency it will be there means they can give. So this is the blood transfusion so commonly used.